Hi, it's Dr. Jim again. I wanted to talk a little bit more about kind of what the treatments are for things like PTSD. So in PTSD, you remember that you have intrusive dreams, recollections, nightmares, night terrors about things that have happened recently, which could be called a kind of delayed stress reaction. Or if it's over a longer period of time, it's called PTSD, or post-traumatic stress disorder. So one of the things that PTSD does is that you're having anxiety about something that happened and you don't want to think about it. Now again, this is a very natural human reaction to things that are anxiety provoking, as we'd rather not think about them. If, this hand were a hot stove and I went to put the other hand on it, my natural inclination is to want to take my hand off of there. As human beings, we're designed to, kind of avoid pain, and that's a healthy thing. But with anxiety disorders, one of the things that happens is that people are avoiding pain that doesn't make sense to avoid. So if you try to keep a thought out of your mind, and that thought keeps coming back, in some ways you're reinforcing the recurrence of that thought. And this is somewhat difficult to understand because the very things that we're kind of programmed to do almost reflexively in terms of avoiding things that are anxiety provoking or painful are actually the same mechanisms that are going to make it worse. This is true of simple phobias as well, where people, they're afraid of something, so what do? Well, I'd stay the heck away from whatever that is. And usually that doesn't cause many problems, but if it starts to, then that's something you need to address. So exposure, again, is another way to treat PTSD. It's in fact probably one of the most effective ways. It's been under study at the Veterans Administration for many, many, many years, and in psychology as well. So a good cognitive behavioral therapist that is experienced in the treatment of PTSD and exposure is a good bet for treating trauma. Another thing which can be helpful is a group for people who've experienced similar types of trauma. And here people, in a supportive environment who share similar types of traumas can begin to re-experience those things in a way that's not threatening. And that's very, very important to the person with PTSD. In fact, in exposure therapy, part of what we try to do is, for instance, ask someone to write a letter about the experience of the event that they had, or to talk about it, or to listen to a tape of sounds that remind them of the event. And to do that in such a way that the anxiety is actually going to increase, but then over the course of a longer period of time than they might ordinarily allow themselves to feel that, to decrease. So an example of this, just for to make it clearer perhaps, is someone who was involved in a very severe pedestrian accident in which an automobile actually, endangered them and physically injured them. Became very fearful of being out in the environment and began to have dreams, nightmares, etc. Stopped working, had a lot of difficulty with that. And going back and just sitting at a park bench near the intersection where this particular accident happened and allowing the anxiety associated with the sounds and memories and things that happened there was very anxiety provoking in the beginning, but over the course of an hour, the anxiety would come down and then do it again and again and again. Then you find out that that's kind of taking away the anxiety associated with that particular memory by allowing yourself to think about it until the anxiety goes down. Not just thinking about it and saying, oh well, that's I can't think about that now. So that in fact over the course of time alleviates these other symptoms and takes away the dreams, nightmares, and night terrors. That's a very simplistic explanation of how this works. You really need someone who's skilled to guide you in this process. One thing I think it's important to point out is that it's never the goal to overwhelm the person who's experiencing any kind of anxiety disorder during their treatment. There used to be a model of anxiety exposure that, the concept was that you place someone right into the thing that they were most fearful of. That was called flooding. And that's no longer in use. So don't be concerned about that. Someone who really knows what they're doing can help you guide you through a treatment that will be effective for these problems. So there's hope, and there are effective treatments available. So if you're having these problems, please do seek treatment with someone who's qualified to do so.